do whatever you can, like you said, to stand up, right, and continue to work and ask for help. And for those who can help, give a hand, whenever you see someone like that. Then as a community and together, then we can be stronger.
This podcast is brought to you by ISU Corp. Are you having trouble with your software projects? Is there a project that's taking too long or a technology you can't handle? We can help. We are ISU Corp, experts in custom software since 2005. With almost 20 years of experience, we can solve any technical problem from new businesses to satellite software. We've done it all. Let us turn your ideas into reality. Learn more about how we can help by visiting us at www.isucorp.ca. Your solution starts here.
Hello and welcome to another episode of your Break Free podcast. I am your host, David Bancela. As everybody knows, this podcast is dedicated to shine the light on leaders that are changing the world for a better place through their organizations. And today we have with us Jian. How are you doing?
I'm good. How are you?
Good, thank you, Jian. I was going to pronunciate your last name, Jian. I think it's Jian, Yang, but I don't
It's
want
like
to.
a Jian Zhang, yeah.
Yeah. So, give me your full name and where do you live and what do you do for a living?
Yeah. So I'm Jian Zhang, CEO of Chinese Hospital here in San Francisco.
Beautiful. Now, this hospital is a hospital dedicated to the Chinese population in San Francisco, correct?
Well, it started that way back in the 1899 when a lot of overseas Chinese came to United States to build the railroads. Back then, apparently, the exclusion against Asian, I guess we all heard about that. So they were not allowed to go to the mainstream hospitals. And that's how Chinese hospital, at that time, it was established as Tonghua Dispensary.
That is incredible. So this is over 100 years old then?
125 years old.
125, that's amazing. Now it's a mainstream hospital and it's open to the public for everybody, right?
That's right, yeah. So it's a acute care hospital. It is here for everybody.
I find it incredible that only 125 years ago we have so much segregation still in society in North America. Isn't it hard to realize that, so little ago we still had all these crazy ideas about different races and discrimination, right?
Yeah, it's very sad to see that, right? So San Francisco, in the past, we used to have so many ethnic hospitals. We used to have French hospital, Jewish hospital, German hospital, and many more. So apparently that, I guess at that time, and they were, all those immigrants, they were segregated in their own community, and then they built their own everything kind of thing. But in the 70s, all other ethnic hospitals were closed or were bought by other health systems. And Chinese hospital at this point is the only independent community hospital left in San Francisco.
Oh, wow. So it's the only one left. That is amazing. What has been the secret of your success of having the organization running for such a long time?
Yeah, so I think that there are multiple factors to that question. One of them is that San Francisco, we have large Asian populations here. So there's 37% Asian, like 23% Chinese here in San Francisco. So there's a huge need for this bilingual, bicultural services, right, for the Asian community. That's one. The other reason is that back in the 70s, when the seismic code at the time was first implemented, I guess, then all those hospitals would have to retrofit, right, in order to meet the requirement. And Chinese hospital received the notice too, that within weeks that you're supposed to fix your stairways, and then it needs to be a few inches wider, and for emergency, like in case that you need to evacuate and take your patients out. There's no way you can just like make your stairways a few inches wider, right?
Yeah.
Like, how do you do that? So meaning that you basically need to build new hospitals, new facilities. And at that time, that the Chinese Hospital Board and the community leaders, they brought this issue to the government and say, look, we understand that we need to meet the seismic code, the new code, but we need your help, right? Because this hospital is very much needed by the community. And so working together, they actually was able to convert the building they were building next door into it was supposed to be a MOB, like medical building, and they converted that into a hospital. And that's how Chinese hospital was saved in 1979. And so the new tower, which was supposed to be a medical building, it was converted into a hospital. And after that, I think the key factor that why we are still here, being the only independent community hospital, is that our visionary board members and physician, the medical staff, and they built this integrated system back in the 80s. So 1982, our medical staff built a medical group called CCSCA, and then together with the board, they founded a health plan called Chinese Community Health Plan. So ever since 1986, the hospital, the physician group, and our health plan, we are functioning as a what we call integrated system. And that we take in capitation payment from Medicare, Medi-Cal, and then we also have a commercial, like the Cover California health plan. So we manage care health plan. And so in a way that about 50% of our patients are actually our own members, our health plan members. And then so we also work with other health plans. And we basically, we're not like Kaiser. Kaiser is a closed system, but we are open system. So half of our services, we're kind of like a Kaiser. We're taking care of our own managed care patients. And then the other half, we're open to take care of other patients. So we are very much open to take care of everybody. But we're really good at that bicultural, bilingual, I should say multilingual, because there's so many different languages. So we're taking care of those a lot of the Asian patients here, a lot of the new immigrants, the monolingual Chinese. And even within Chinese languages, there's Cantonese, Mandarin, and Toisan, and a lot of other dialects, right? And so we are, in our kitchen, we cook Chinese food, we cook Western foods, and for different patients. So we are very sensitive to cultures. So we call ourselves, we're providing culturally and linguistically appropriate care to our patients.
Isn't that beautiful? It's incredible, the stories that you tell. I'm a man of faith. Like I follow Jesus Christ. He's my savior and the reason why I'm here and doing this podcast. And when I hear the story of your hospital, how every other cultural specific hospital is out of business and you guys still around, and how in 1979, right, when you were able to move to the other building, that's a miracle. Yes. If that didn't happen, I wouldn't be talking to you right now.
Exactly. And then the 125 years of history is really rocky, right? It's never easy at any given point. And then, so in 2016, we actually built another new tower. And so because the 79 building now is old, right? Because it wasn't a hospital to start with. In order to meet the healthcare needs of the community, we raised money and, we borrowed some money and plus the operational surplus, we spent $223 million to build a new tower. And so now the hospital is actually really a new building. And during the pandemic, and it was really good to have this new facility. So if needed, we could turn the entire floor into negative pressure for COVID.
Wow.
And
Wow.
yes, and we had plenty of isolation rooms for quarantine patients. So during the pandemic, it really helped us. Of course, then during the pandemic, we went to the community. We did a lot of preventive, what we call, kind of like education, prevention, contact tracing, quarantine, linkage of care and vaccination, a lot of testing too. So this is kind of like a really comprehensive program during the pandemic. So we safeguarded the community. In history, this is not first time actually during a public health crisis that Chinese hospital saved the community. And so, that San Francisco, Chinatown, it's the second most densely populated area in the nation.
Wow,
And
I didn't know. That's amazing.
yeah. So at the very beginning of COVID, everybody thought the outbreak was going to be here in San Francisco, Chinatown. And we thought so too, right? Because it just is so crowded. And we have a lot of single room occupancy residents here, and low income new immigrants, a family of 4 live in one room, no running water, and they 12 to 16 people share a bathroom, share a kitchen, share a shower room.
Wow.
So when we toured the SRO, we call them SRO, the single room occupancy hotels. And we said, oh my God, how are we going to quarantine people? There's no way, right? How are you going to social distance people? And so we kind of work very closely with the SRO owners, the managers, the DPH, and the community associations, our elected officials, kind of really to come up with plans to really try to help these people, educate them how to keep themselves safe, like clean the doorknobs, clean their kitchen services, and all those, right? Kind of like, and don't go to the kitchen altogether, kind of take turns to cook and all those. So this is very early on. And then later on we did people were scared, really scared at the time. And also too, very sad, in addition to COVID, and then you get that anti-Asian hate. And so our seniors got attacked, and then our employees got attacked in public transportation and on the street. And so our seniors, they're horrible. And then they were too afraid to go out. Even though they need testing or need vaccines, they don't dare to go out, right? So then they will, we have to deliver care to them. So we basically went to the community to provide testing, vaccines, and some staff would carry a pouch to knock on doors to give vaccines to the seniors who are too afraid to come out. And so it really helped that we reached a very high percentage of vaccination rate very early on. Like we reached 88% of vaccination rates among the seniors very early on. And so that, I think, have a lot to do with we are one of the areas with the lowest infection rate and death rate.
Really? So
Yeah, this
despite that you
vibe.
had the second largest concentration of people in the country, you were the one of the lowest.
Yes. Yeah.
That's
So that's
that's
why we're
that's
very
success
proud
story.
of that. Yeah, we're very proud of that. As a community, we did very well. We worked together. And again, like I said, this is not the first time during a public health crisis that Chinese hospital took the lead to safeguard the community. And right after Tonghua Dispensary was built in 1899 and early 1900 when bubonic plague hit San Francisco. And back then it was worse, right? The anti-Chinese and then what they did is that they literally built walls around Chinatown.
Wow.
And basically, Chinese hospital back then, Tonghua Dispensary was the only healthcare facility people could go to for healthcare. And it was Chinese hospital at that time, to provide the preventive care and treatment and public health services actually to the community to save the community. So it's not just, to me, Chinese hospital is not just a hospital. It's very much part of our history. And, it just really the community services, as an acute care hospital, normally patients will go to you, right? But we, on the other hand, we have been going to the community whenever there's a need. And then we expanded our program and services that way too. Because in the old days, immigrants come to United States, come to San Francisco, they stay in Chinatown. Not anymore, right? People move out to outskirts of San Francisco and to other areas of the Bay Area. And so we expand our services to the areas with the high percentage of the Asian immigrants. So we have outpatient services in outskirts San Francisco and northern San Mateo County. So kind of like we basically exist to provide culturally and linguistically appropriate care to the community whenever there's a need. Either it's a primary care, or other specialty services, or we even have east-west services, like the acupuncture or herbal care and all those. And so we kind of really try to create programs and services to meet the healthcare needs of the community.
And Jian, number one, thank you for being in the show, and thank you so much for your work. I want to say something that it's astonishing for me. If you look at the homeless situation in San Francisco, it's probably one of the worst cities in the States, only in North America for that matter, with that problem. But if you look at the population in those conditions, I don't even know that you have any Chinese representatives in the homeless community. So your healthcare, the community around providing the services to people is really helping preventing them also from ending up in the streets, under the harshness of the environment.
I think healthcare, it's actually really needs to be holistic, right? It's a lot of the social determinants. You're right. Like homeless, like how do you take care? It's very, very difficult to take care of the homeless populations because let's say use diabetes as an example. You really need to eat that healthy diet and you need to exercise when they don't even have a roof, right? And then they will just eat whatever food they can get. It's hard. And so I wouldn't say there's a none, they a few. I think that Chinese homeless it's still there, but even though I guess the Chinese immigrants, they work so hard. And when I was an international student here in UCSF, and I used to stay in this apartment, and it's a house actually that I leased one room, And inside that house, you see the landlord, four of them, the new immigrant. They work very, very hard. Both a husband and wife work 3-4 jobs. Like they work so hard. They bought that house, but that they rented out all the rooms upstairs, and they only stay in one room. We're a family of 4. They stay in that one room, and a kitchen and downstairs. That's how they made it. Like a very, very, very hardworking. And then when they save money and to buy that house, you can tell not to like enjoy that entire house. They rent it out to help them pay for the mortgage, pay for the insurance, pay for all those things. You know how they make it. Now, you see the very second generations, the 2 children, they have 2 children. And last I checked in was that the daughter became a nurse practitioner. This is like a very the couple didn't speak any English.
Wow.
They work in a sewing factory. The husband work in the restaurant. They work like multiple jobs in that, like work 7 days a week, and that's how they made it. It's just amazing to see how culturally, it's like a really, really hardworking culture, and I don't know what to say. I always got emotional when I see that. But they work so hard, and they don't complain. They just keep working 3-4 jobs. And the wife work in sewing factory and also work as a housekeeper and some other things. And then at night they still bring home those sewing. They continue to sew, and you hear that the sewing machine really late. That's how they made it. Again, the very second generation, they made it to the professional job. The daughter is a nurse practitioner, and the son, I didn't lost track later on, so I don't know. I know that the son went to college too. So that's how they make it. They get really.
And Jian, one of the things that I see, and it's a pattern. I'm a computer scientist. My main business, my first business, is to build software for companies to automate their processes. And to do that, you need to identify patterns so that you can actually improve on the pattern and make it better. And what I see is that for immigrants to North America, at least to what you and I know, I see people that come with such a sense of gratitude, and they see the opportunity because of their places we came from were 100 times worse. So you come to a place like North America and you say, this is my time that I can actually take care of this, and you are grateful and for giving the opportunity to thrive. I was like you. I came to Canada to go to university to do computer science. But even with that position, I'm like, Father, thank you, Lord, thank you for this great opportunity. So I did work also hard after I graduated. I was working for more than 10 years. I had a full-time job and a part-time business that I was trying to grow. And so I did whatever I could to get my family to the next level. Now all my kids are college graduates, and our standard of living is much better. But it's because we have this sense of gratitude, and we know this is an opportunity of a lifetime that we cannot take for granted. And that's what makes people successful, isn't it?
Yeah, there's many touching stories, by the way. So I think that's right. This is there's many ways that you can make it. Apparently, that yes, it is for the immigration community, and I guess I've seen a lot of very inspiring cases. How new immigrants work so hard and made it, to very successful, and then they go back to give back to the community, or even to their own country, the original country, like help train people and do a lot of things. It's yeah,
You know,
touching.
I'm from Guatemala, a small Central American country underneath Mexico.
Huh.
And in Guatemala, the biggest industry that brings the most US dollars into Guatemala is immigrants that send money back to their families.
Yeah.
That's the big, like even bigger than agriculture, right? Even bigger than any other manufacturing. Everything, it's tiny compared to the amount of money they get from people that live overseas and send money back to their families.
Yeah. Amazing, isn't it? Yeah.
Incredible, yeah. Jian, how about you? How did you made it? How did you made it into the healthcare industry and becoming the CEO of such an important hospital? Where did you go to? So you went to school. What did you do after university?
So originally I came from China. So I finished medical school in China. Then I came to UCSF for a master degree and in nursing actually. So when I came here, that was back in 1990. And when I was an international student, and my advisor said, "Why don't you go to Chinese hospital for your clinical rotation?" And then I was really surprised that there's actually a Chinese hospital here in San Francisco, United States. And so, yes, I did started my clinical rotation here at Chinese hospital. Back then, it was a very, very different, there was a lot of new immigrant women here, and they couldn't afford mammogram. And so breast cancer, it's like 1 in 8 women would develop breast cancer in their lifetime. And a lot of women, they would take care of their family. They work 3-4 jobs like my landlady, right? But they wouldn't take care of themselves. When they find out that they have breast cancer, it's usually late stage. And the breast cancer, if you find early, it's curable. But if you find late, then it's a fatal. And so I started bringing in grants to help pay for their mammogram and provide free educations to them to help them like healthcare classes and all those. And it was really hard back then. It's not like now. Most of people have insurance because of the exchange, right? So a lot of people have health coverage, and not back then. And there's many people low income without insurance. And so then later on, I brought in the Every Woman Counts, kind of like a free services for this woman, and so they can access free mammogram, free pap smear, and then later on expand to other services like immunizations, and it kind of like really, that's how I started, at that time. And then after I graduated and I started working here, so before you know it, I work in many different departments. I work in emergency room, med surg, and education, case management, and later on went back to school and got my family nurse practitioner license, and kind of started working at the clinic. I started the first clinic, and also as the clinic manager and nurse practitioner working there. And later on, we expanded, we created more clinics, outpatient centers. And so I spent 20 years building all those outpatient services. And then in 2015, I came back to the hospital as a COO. And then I was promoted to be the CEO in 2017. And so I went back to school again in 2010, actually, and to get my doctorate degree in nursing practice, more so in executive leadership in healthcare. So really that kind of, I have been 30 years. It has been 30 years. It's been a long time.
I love your story. And for people that are listening, this is why it's called the Break Free program, because the people that are interviewed like you have amazing stories. And the secret is the dedication, the commitment, the vision, right? You went back and got a doctorate degree, and with that, you opened the door for yourself to be at the top of the hospital. You didn't even know, because that happened 7 years later. But you were ready then, right?
Yeah. Education is very important, right? So I think that in the immigrant community, and at least in the Chinese community, and I think that we really emphasize on education a lot. And my landlady's example, so she and her husband both didn't speak any English, but she sent her 2 children to school, like to really make sure that they got the best education. So that's why the very second generations, both of them became, have like a professional, right? The daughter was a nurse practitioner, and then the son, I didn't know where he worked, but I know that he went to a college and say he was going to be an engineer. So that's kind of like how you change. Education can help them get out of that poverty, right? Get out of that situation where, they have to work 3-4 jobs because it's low income, right? Like the minimum wage, they have to work 3-4 jobs to make their ends meet. So I think that education played a huge role there in the immigrant community.
It's amazing. Yeah, and it's for sure. We call North America the land of opportunity, and it truly is, but you have to discipline yourself. You have to be grateful, and you have to do whatever it takes to not only survive, but start thriving. Yeah. I am a clear example of that. Like people say, oh, you have so much and you run all these companies and this and that. They didn't know that, I had to go to English school for at least 6 months before I could start university, because my English wasn't good enough. But nothing was going to stop me from studying computer science in Canada. I already had a computer science degree from Guatemala. Like you already had, your medical degree. But, I went back in the 90s, 1991, nobody will validate my education. So what I did is I got a job during the day, and then at night I will do 5-6 hours of English every night.
Wow.
From 5 p.m., sometimes until midnight, and I applied myself. And then after I graduated from computer science, I didn't have the luxury to just study. I was working a full-time job while I was going through computer science school. I was the only kid in the whole college. Why? Because I didn't have any money. And I had a wife, and I already had 2 kids. You see?
You have to support your family, yeah.
But it went like that, Now my kids have it easier, right? My kids were a little bit better. My daughter, my youngest daughter, she went to University of Toronto, which is an Ivy school in Canada.
Great school.
Yeah, and she graduated from English, which is their flagship program, and she got the privilege of not having to work. She only worked in the summers. She didn't work during the school year. And I feel blessed about that, because it was the sacrifice of my wife and myself. When I started my business, my wife was running the whole thing. Until I finally got stable in a job, my wife could go to computer science, and she graduated from there.
Wow.
That enabled us as a family to run my business later on. In 2005, I told my wife, okay, I'm ready to start my company. Would you pay the bills? And she was paying the bills for me, because she was already a professional. And, and she supported me all these years. And when I started my business, I was working at least 17 hours a day, trying to make ends again, you see?
Very inspiring story, by the way.
But it's when you are willing to do whatever it takes to reach that success, that's when the breakthroughs happens. And, especially when you're a person of faith like me, I'm like, Lord, tell me, what do I do here? What do I do there? And when I fail, I just pick myself up. The Bible says that everybody fails 7 times, but only the just gets up 7 times too.
That's right.
Because it's not about failing, it's about how many times are you going to get up.
That's right.
after failing.
I think that the first lesson we need to learn, it's how to get up when you fail, right?
Yeah.
It really, that's why I think I like to send my kids to sports, because when you play team sports, you lose. You have to lose, right? You can't win all the time. So that's how they learn how to deal with failure. And I think it's most important lesson in life that we need to learn is that, how to deal with failure. Because if you can deal with failure, then it would be easier to move on. Otherwise, it would be difficult.
Little did I know that I was getting trained on rejection and failure. I was rejected so many times in my life because of my business and my career. And now I do this podcast. And at the beginning, I had a lot of rejection and failure. But it didn't matter anymore because I'm so used to it that it's okay, next person, And now the podcast became so popular that I get the privilege to interview people like you. You see?
That's good, yeah. And I think that if people can learn from our stories, our failure, our success, I mean, it comes with together, right? So people will say, oh, that's okay. They're a new immigrant. They made it, right? And so they can too. I think that would be good if we can be any help, any hope to others. That would be great.
Jian, for my podcast guest on this Break Free podcast, the great majority of people native from US and Canada, they are native from here, but they have the same attitude as you and I have. The very successful people, they have the gratitude and they know they have to work for what they want, and they know they are willing to do whatever it takes to achieve what they want in life. And that's the secret to success. And figure it out, get mentors, train, pick up yourself after you fail, and then you will enjoy that beautiful success and abundance, right?
And then you can give back. You can help others, right?
That's what you and I are doing in this podcast. We're giving back our time and our wisdom to the people, right?
Yeah.
Jian, thank you so much for your time. It's been 40 minutes already, incredible, 40 minutes. I don't want to abuse your time. I'm going to ask you one last question before we finish the podcast. If you had access to a billboard in front of the busiest highway on earth, what would you write in it?
I think given the topic we're talking about, I would say, help people, I guess because of where I am in San Francisco, you see so many homeless people, so many mental health, behavioral health issue. It's like a national crisis. I want to say, do whatever you can, like you said, to stand up, right, and continue to work and ask for help. And for those who can help, give a hand. Whenever you see someone like that, then also community and together, then we can be stronger.
Amen to that. Jian, thank you so much for your time. If people like to follow you, where can they find you? Are you on LinkedIn?
Yeah, the LinkedIn would be a good way to find me.
Excellent.
Thank you so much, David. Your story is really inspiring too.
Thank you so much, Jian. God bless you. Have a beautiful rest of the week.
You too. Thank you.
Bye-bye.
Bye.